Primary healthcare has always been one of the major drivers in determining the social and economic strength of a nation. In this light, taking on the responsibility of bettering healthcare from the grassroots levels, Helping Hand Foundation and SEED USA, that are working with weaker sections in healthcare a shade less than 20 years, are now working on strengthening the primary healthcare system across the city.
Helping Hand Foundation has strategically set up 3 primary healthcare centers. We've been doing this in the last 3 years. We've set up our health centers in vulnerable slums of the city where people do not have adequate access to good quality care. Many people ask me, you have Basti Dawakhanas, you have the government primary centers, what is that HHF is trying to do? So my response to that is that we bring in a good quality primary health care. So we focusing on hygiene, we are focusing on state-of-the-art facilities, we are focusing on providing quality medicines, quality clinical care.
The main aim in setting up these health centers was to not only ensure primary care, but to integrate a wide range of non-pharmaceutical interventions that would add value at the PHC level. All 3 clinics today have a well-defined prevention and control program for NCDs managed by a senior doctor, a team of OP doctors, counselors and a nutritionist.
We are focusing on both. We are trying to educate the people on what they are going through and what are the complications they would land in if they are not interfered on time properly.
In one of our women's clinic center, we have integrated a wellness program along with NCD. So in the wellness programs, the women are taught aerobics. The women, especially with higher BMIs, obesity and other reproductive health issues, are enrolled into the program. They are taught aerobics, they do gym, they do the treadmill, the dietitian there who advises them, and this is happening for the first time at the Basti level.
पहले वेट के वजह से सब लोग हंसते थे, एम्बैरेसिंग फील होता था। तो ये जब से जॉइंट हुई, जब से थोड़ा वज़न 3 किलो केजीज वेट उतरा और बॉडी एकदम रिलैक्स फ्लेक्सिबल हुई, स्ट्रेचेबल हुई। पहले झुके तो दर्द होता था, हैवी बॉडी लॉक हो जाती थी और काम करने से ब्रीथिंग प्रॉब्लम होना शुरू हुई। बाद में यहाँ जॉइंट हुई वर्कआउट की वजह से अब बहुत ज़्यादा रिलैक्स हो रहा और जो भी बॉडी स्ट्रेचेबल हो रही, काम भी अच्छे से हो जा रहा, डाइट प्लान भी अफोर्डेबल है। मैं बहुत शुक्रगुजार हूँ हेल्पिंग हैंड और राबिया क्लिनिक की।
Those who are already morbid with diabetes, hypertension or more, it entails screening for complications including eye, renal and liver test.
And the good part of this clinic is that it is not just, case of just seeing the patients and giving them medication. No, we go a little beyond that. We talk to them, we know about their problems, we try to solve their health issues, we advise them, we counsel them, we refer them, we follow them up, and also if they need any advanced surgery, if it cannot be done at the government hospitals, we do finance them for such type of medical procedures which probably they may not be able to afford, or if they neglect it, may land into a more difficult problem.
Globally, over 1 billion people suffer from visual impairment and most of them do not have access to good eye care. Keeping in view this need for community-level eye screening, HHF-SEED have set up a full-fledged community ophthalmology screening program with state-of-the-art equipment at one of its PHCs under a senior ophthalmologist. For the first time ever, HHF-SEED also introduced dental services with a full-fledged dental chair with all other facilities in the 3 PHCs under a highly experienced dental surgeon and team. These community-level screenings have so far helped identify hundreds of hidden chronic cases which would otherwise lead to complications and have debilitating impact on health and the financial well-being of the patients.
infectious diseases like common cold, upper respiratory tract, lower respiratory tract, as other diseases like asthma. And we also, and if some surgical cases also come here, then we just diagnose, get investigations done, and we refer these centers to higher centers like Usmania General Hospital, and Nilofar Hospital, like this.
Offering their services to people of all communities and backgrounds, these health centers that are run in the mosque make it accessible and feasible to all, saving huge out-of-pocket expenses, and stand as a testament of the selfless charity HHF and SEED have to offer, alongside adding a spiritual ethos to the many vulnerable who come for treatment.
We couldn't have done this without our partners, SEED USA. It's through their support that we started this clinics, and they in turn have support from other organizations like Imana. And this is my fervent appeal, especially post-pandemic, where we are seeing a lot of changes in the healthcare system, that we want to further work on improving our primary health systems. And I appeal to my donors and all those who are watching this to come out and support us in this noble cause.